Stigma causes fear and isolation. Our future becomes limited when we can't reach out. Learning to connect with others beyond what we see allows us to create more meaningful connections. Stereotypes lead to misconceptions, and misconceptions lead to discrimination. We will reflect on how young people play a significant role in eliminating these viewpoints. Social exclusion hinders progress, and no progress means we aren't moving forward. Let's talk about how we have the power to change this. Prevention efforts for young people can be achieved with these 4 tools: compassion, understanding, normativity, and tenacity. It's time to unpack how stigma impacts prevention efforts in 2021. Let's begin.
Hello, everyone. Welcome to the first session of No Time to Wait. We're extremely excited to have you here, and there is truly no time to wait when it comes to addressing the HIV/AIDS epidemic. I'm Arihan Boli, and I will be the moderator for this event. Our session is Shackled by Stigma, Stereotypes, and Social Exclusion. This event will focus on unpacking stigma towards people impacted by HIV/AIDS and understanding how discrimination affects prevention efforts. We have 3 amazing speakers for this session. Throughout the presentation, feel free to post session and hop in. They will be answered by speakers during our Q&A time. Without further ado, I let our first speaker, Milo Gray, get started. Milo is a youth peer coordinator at Healing Our Nation. Hi, how are you today, Milo?
I'm good. How are you today?
I'm amazing. That's amazing to hear that you're good. So, without further ado, let's get started. Take it away, Milo.
All right. So my name is Milo Gray, and I'm a community health educator and youth peer coordinator with Healing Our Nations. And Healing Our Nations was formed in 1993 by 2 Mi'kma'ki people that were concerned about HIV and AIDS and the effects that it could have on our communities. So together they asked to share the teaching to our people just about the virus and stigmas related to it within the community. So today, First Nations, Mi'kmaq, and Maliseet communities across Nova Scotia, New Brunswick, Prince Edward Island, and Newfoundland have joined the effort to help us promote awareness on healthy living and battling stigmas with HIV and AIDS. Myself, personally, I started with HON about 5 years ago. Before that, prior, I worked up north in Nunavut in a small Innu community, Cambridge Bay. And being there, the experience of the north, it's a rare one coming from Nova Scotia. So for me, it was, I fell in love with the culture and the different culture from the East Coast to the North. And in doing that, I came back home and I partnered on with Healing Our Nations as a peer support worker. And in doing that, I kind of fell in love with the traditions back home, and I've been here ever since. And I love educating. And with Han, we actually, like I said, we don't charge any communities for our services. It's totally free of cost. Our educators would travel to different provinces and smaller communities to educate on things like HIV and STBBIs, as well as stigmas related to hepatitis or HIV as well. Here at home, we actually have what we call our APHA, which would be Aboriginal persons living with HIV. And we have a fund that we actually contribute to medicines with them. We can't offer a lot of money because we're a nonprofit organization, but our mandate is to kind of help and meet people where they're at. So what we do is we offer a small amount of money to each participant that is within our program with the APHA fund. And in doing that, it helps them kind of with medicines and just with a little bit of the financial strain of the medications and whatnot. Each year we do a different event to kind of fundraise money. This year we did our Every Child Matters shirts, which was pretty popular. So we were fortunate and lucky enough to raise upwards to $5,000 in just selling the hoodies and t-shirts for our APHA fund. So in comparison to last year with COVID and everything, we kind of lost a little bit of those dollars with that. But this year we kind of recouped, and now we should have money to fulfill that APHA fund and for about the next 6 months, which is a really good opportunity. And with what we do here at Han within our workshops and stuff, we are a harm reduction organization, but we do focus. Originally, we were known as the AIDS Coalition of Nova Scotia. So rather than just serve one province, we actually branched off in a way where we can hit all the First Nations communities in the Atlantic provinces, including New Brunswick, and as I said, prior PEI in Newfoundland as well. Sorry.
Oh, nothing. Continue.
Okay, sorry. So a lot of our workshops here would include, so we have culturally appropriate interactive education sessions. We got away from the PowerPoints and wanted to make our sessions more hands-on, we wanted to be more at the ground level and didn't want to seem like we're someone from outside of the community coming in trying to make it seem like we know everything, or we want it to be more of peer education. And that's kind of the mandate we go with our HIV education as well. We do have some peer mentors, so people who are living with HIV that actually mentor other individuals that are part of our APHA program. And in doing that, it allows them to have peer support, which I think is extremely important as far as breaking the chain and help battling stigmas. It's extremely important to relate to people that that kind of have had a lot of the same issues or have dealt with a lot of the same barriers that you dealt with, because again, offering insight's most important, and that's kind of the mandate of our services here at Han is offering insight to those individuals. When I was given the original email from Kate, I was reading through, and the immediate thing I thought about in reference to our work in correlation with the mandate of this session today, breaking the chain. I thought about breaking the chain of stigma and reconnecting the chain of awareness. I think that's pretty much the mandate of Healing Our Nations today, and more so a mandate for anyone that's trying to battle or help decrease or just put awareness into the actual stigmas that are associated with HIV and AIDS as well. We offer, like I said, a small amount of financial support monthly to APHA partners as well. We do also youth peer support. So what we do is we do youth mentoring and elder mentoring as well with 2 of our sessions that we hold yearly. Again, with COVID, it was pretty hard to get and establish groups together, but with the restrictions kind of being down, we focus more on hitting the communities now that we haven't hit in a while. Between myself and the other educator that we have, we actually visit all of the First Nations communities that we serve, and multiple times, certain times, depending on the need and the want. But what Han does, again, to help people overcome the stigma, I see a lot of situations in community where, even with STBBIs, it could be when you have First Nations communities and have small populations, where the health center could be one of the most fearful places for people to go sometimes, because you might have an auntie or a relative that works there, and your immediate worry is the transfer of information or privacy. And we always reassure our participants when we're educating that, there is an obligation to keep privacy and confidentiality, but there are other ways around it. So offering the information, I think, helps reconnect that chain of awareness, where maybe you're aware that the health center does have protocols to protect their clients as well, but there's other ways to go around that, maybe by scheduling a private meeting or making a telephone call and having some third party or indirect communication with somebody in staff that you can schedule a meeting to be a little more discreet. But we also offer our education to non-Aboriginal services and businesses as well, to kind of give them insight on the ground level, on what prevention is about, and more the awareness and celebrating and encouraging harm reduction.
That's amazing. Thank you so much for sharing with us, Milo. It was very thought-provoking and interesting. Just for everybody, could you please clarify what STBBI means?
Yeah, most definitely. So STBBI, it's sexually transmitted bloodborne infection. The Nova Scotia Health Authority, or the Health Authority of Canada, actually got away from the STD, sexually transmitted disease, because of the derogatory association that comes along with the word disease, and infection as well. So, and everything is blood to blood. So they're looking at that connection of blood to blood. So where harm reduction comes is more so creating that barrier. So when it comes to everything is under the same umbrella now, I often educate during my HIV sessions. I start by explaining that there are millions of people living with HIV that are living full, meaningful, sexually active lives. It's not necessarily a death sentence anymore. And the awareness piece to let people know that people are living full, active, sexually active lives is extremely important. And you'd be surprised at the amount of participants at my workshops that are surprised by that. But then with the further education on PrEP and different medicines that are used to prevent that as well.
That's amazing. Thank you so much. So our next speaker will be Claudia Medina. She's a program manager at Prisoner HIV/AIDS Support Action Network. How are you?
Hello. Hope everyone is fine. I'm hearing some feedback, just FYI on your end. There we go. Getting better. So my name is Claudia Medina, and I work at Prisoners HIV/AIDS Support Action Network. We're an organization that's existed, since the epidemic started, and primarily was started for people living with HIV and people living with HCV who were inside. Folks were calling in during the epidemic. There's a bit of feedback. Calling in during the epidemic, and what we were seeing is that they needed support. They also needed a lot of education around what they were living with, basically, because they were finding out, diagnosing while they were inside. So we go in and do presentations, educational presentations around HIV, HCV, and harm reduction. We're a harm reduction organization. And we definitely, work with a lot of folks who are marginalized, who are currently not housed, who are living with HIV, HCV, and are drug users. So, our mandate is basically to help folks, ex-prisoners who have been in prison in the community, and then also to be able to go into the prisons, the federal and the provincial system, to be able to support, do one-on-one calls and do one-on-one meetings with folks, and also do our educational programming. So I want to show you a video of someone with lived experience, because I don't have lived experience. So I wanted to give a chance to Laverne to be able to share her story. And you can put the video on right now, okay?
Hello. So I'm going to talk about stigma stigma and living in prison, which unfortunately at one point I did have to be in there in 2010 when in unfortunate circumstances. I ran into a lot of numerous problems, and the three things that stuck out was disclosing my HIV status in prison, because you're very pretty much on your own. And these nail clippers was a big thing, because if I were to use them and I have HIV, it was huge. And disclosing my HIV status was one of them. And the guard didn't help, because it's damn if I do, damn if I don't. Another thing that stuck out to me is finding resources while in prison. And the only reason I found resources was because another prisoner. So they need to advertise a little bit more differently for prison, for women who need resources when they get out. That's something that we struggle with when we're in prison. And another one is staying connected with your family and friends, because when they find out that your HIV is positive, it's nothing like fighting a battle with your family and community when they find out your status. So those three things, my friend, stuck out to me a lot. So I hope this helps in any which way, because me being in prison will never happen again, as it was a really a fighting battle. It's no ballpark. Miigwech.
So that is Laverne. She is a huge advocate and also leader. And I would say on her way to being an elder in the community. And, I thank her very much to be able to support this conference, even though she's not able to be here. So since she's not able to be here, I want to definitely ask everybody, if Kate, you can share my email address. So it's claudia@pasan.org. And it would be really great if people gave her feedback on her video, which she was very curious about what people would think about it, and just give her some props, because she's amazing. So, in regards to stigma and HIV, I got to say, things haven't changed. So Laverne is talking about an experience somewhere around 2006, 2007. But the stigma of HIV still exists. While there's, less prevalence of HIV, a lot of those have to do, though, with, and keep in mind that the statistics that we rely on are from Corrections Canada, and the Ministry of Solicitor General. So unless they take out, the appropriate statistics, then the rest of us are not going to know what is actually happening inside. So our estimate, and what we have had since 2005 is the fact that HIV exists within, just like everything else, within prison 10 times more than it would present on the outside. So those are things to keep in mind. So a lot of the things, like Laverne mentioned, that people experience inside when they're HIV positive, is mainly privacy. There is no privacy in prison. Just keep that in mind when we are talking about prison and HIV. Reason being, you're sharing a cell with people that you don't know, and if you disclose your HIV status, which is something that people to this day are not doing, or not wanting to do, you do face a lot of stigma, a lot of discrimination. So a couple of years ago, we received a phone call. This is just an example, from someone in a provincial prison. And he had mentioned that he had lots of time to talk on the phone, because that phone was specific for him. And we said, well, how's that? And he said, it actually has a sign that says HIV phone. So that was 2 years ago. So as you can imagine, the issue of stigma still exists within prison. So part of the reasons why folks don't disclose their status, or the fear of stigma, um, a lot of it has to do with not having the privacy. So when you get your medications, you would go to healthcare. There are still med lines, primarily in provincial prisons. And so people get curious. What are you taking? What are you doing? Especially if it's someone in your cell. So once someone knows, the likelihood is that everyone's going to know. So that includes prisoners, and it also includes correctional officers. So we have heard really sad stories of people being discriminated against, people inside not wanting to share their cell, people not wanting to touch, including correctional officers not wanting to touch objects that have been touched by HIV positive people. And this is 2021. I just want to remind folks, we know this from prisoners. They call us, we have conversations with them, really intimate conversations that they may not, even as you heard from Laverne, be able to talk to their own family or friends about. So it's important to keep that in mind. And, while the HIV rates, again, do not show that they've increased, the likelihood is that they have, but we rely on statistics, up-to-date statistics, which come from Corrections Canada. So apart from that, I just want to say that the criminalization of HIV plays a big part as well, because if you go to prison because you don't disclose your status for HIV, then you're already stigmatized because you're HIV positive, and you already receive discrimination. So that gets tenfold if someone finds out what you're in prison for, and the judgment that comes along with it. Practically ignoring, and I hope everybody knows about U equals U. Undetectable equals untransmittable. So that message needs to get inside, and we do deliver that message when we go inside. But unfortunately, some folks don't believe it. Some folks don't understand it. So HIV, again, is a huge stigma, and folks, continue to struggle inside. So that's why it's important for people and organizations to be able to start thinking of prisoners. When you think of society, just because prisoners are put away from society, and when I say put away, a lot of prisons are, very far from the city. For example, here, federal prisons are 2-3 hours away. Provincial prisons, even though they're in Toronto, you have to go outside of Toronto, and it's very complicated to go outside because you have to take transport, you have to take 2 buses to get there. So again, the illusion is that prisoners don't matter. And so it's really important for folks to start incorporating the realities of people living in prison, and definitely think of those with HIV, those living with HCV, and harm reduction is something that is still lacking, and there is a lot of stigma in regards to using drugs still to this day, inside and outside of prison. So it's really important that we prioritize these issues and provide more support for people living inside a prison who don't have the freedoms that we have. Thank you very much.
Thank you so much for sharing your experience with us, Claudia. It was extremely moving. So next up, we have Reverend Philip Weaver. He's a certified spiritual care practitioner and educator at Casey House Hospice. How are you doing?
I'm not at Casey House anymore. I used to be. I'm actually at North York General now.
That's amazing.
But, yeah, so I'm actually not here representing any particular organization, although I have been a past president of the Canadian Association for Spiritual Care, l'Association Canadienne Soins Spirituels. It's a bilingual national organization. And yeah, I'm here because I've been involved with HIV. As I look around the room, I think, most of you were not born in 1981 when the first sort of mainstream article about HIV was being written. HIV was a term that didn't exist then. It was, the gay compromise syndrome or some bizarre thing. Um, so as I talk about this, I think imagine yourself 40 years from now talking about you knew life before there was COVID. I don't know what life is going to look like 40 years from now in terms of how COVID is going to impact what we do and how we live. But I can remember a time before HIV/AIDS. And as I've watched, 4 decades of people struggling with this, I also wondered, how we're going to struggle with COVID along the way. Um, just a little quick something. One of the things I was asked to do was kind of think of how would I introduce myself. And I was at an event recently where I was asked to say what my favorite word was. And my favorite word is both and.
Okay.
Both and. Some people kind of say, well, that's not one word, that's 2 words. And I say, yeah, but you have carry on luggage. You've got, mother-in-law. Those are, compound words. It's really one word. I think both and describes what I think of about the relationship between stigma and religion and HIV. It really is kind of a both and. There's an awful lot of stigma that has been sourced from religion. There's an awful lot of religious figures, especially in the early days, who were saying, well, this is a homosexual disease, and so this is God's punishment because they are doing sinful things. And if they weren't homosexual, they were probably heroin users and injecting, and they were just bad people. Or, they just kind of, spoke from a position of judgment, of hatred, of discrimination, seeing those who were infected and affected by HIV as the enemy, as the other. But I think, at least within some spiritual traditions, I'm going to use a little story that comes from the Christian tradition, where there was a man who was born blind. And some people, brought him to Jesus, and their question was, did this man sin, or was it his parents who sinned? Because they were looking to blame and shame. They were looking to understand, what's the punishment that this person is experiencing, and, do they deserve it? And Jesus' response was, that's the wrong question. It's not about assigning blame and guilt. The question is, how are you going to act in a way that honors your faith? How are you going to do the right thing, the godly thing, the good thing in this situation? And I think that those 2 ways of responding to HIV are really there in pretty much most religious traditions. That there are some who are looking just to assign blame and looking to kind of exclude and punish and see that as somehow they're doing the will of God by hating others. And some are moved more in that place of compassion and that place of, how does my faith manifest in this situation in a way that is of God, of goodness, that glorifies those values that I say I hold. And I think there's always that tension. And I began by talking about the COVID piece a little bit because I find myself still struggling with that. I work in healthcare and kind of the intersection of faith and health. Done that for about 35 years now. And the other day I was in a hospital room with someone who was in hospital because of COVID. He was on oxygen to help him with his breathing. And I was coming in to tell him that his mom had just died of COVID in the same hospital, and that his dad, he already knew, was in the hospital on another floor in intensive care. And this was a family that was not vaccinated. And they had said, we don't need to get vaccinated. We don't believe that this COVID thing is real. And I had to struggle in my own self whether or not I was going to be judgmental. that question about who sinned, who did the wrong thing, who didn't do the right thing. I found myself asking that question. And I didn't want to operate out of my sense of blaming and shaming the other. But it takes some work to kind of say, let me be with this person in a compassionate space. He's just lost his mom. He might lose his dad. He's struggling with his own life. He's got all kinds of fears and grief. And how can I be with him in a way that when he's feeling so alone, that maybe he's not quite so alone? So I think part of that whole stigma discrimination stuff, at least for me, is there's what can I try to do about addressing it when it see it outside myself, but also what do I do with myself in terms of my own spirituality, my own faith, and sometimes there are places in the religious community where I can find support and assistance with that. Sometimes there are places in the religious community where I need to kind of challenge that. But it really kind of has to come from me, from my values, from my faith, my beliefs about how to live a life that benefits those around me. Because most religions will say something along the lines of, treat other people the way you want to be treated. That's kind of almost like a universal ethic. And I think that is fostered by the healthy kind of religion and spirituality.
Yeah, it was very interesting. I love how you brought faith into healthcare. It was extremely interesting. So thank you so much for sharing. So we're now going to be moving into our Q&A section. Any questions that you have for any of our speakers, feel free to type them in now. And let's see them. So the questions are now coming in. So this question is for Milo. What barriers do you face when working with communities that have historically faced many inequities? You're muted.
Direct barriers that I would have faced directly. I don't live in community myself, so it would be associated with times where I'd be at work and doing sessions or having one-on-ones with certain individuals. It's really, I'd say the biggest barrier is education and awareness, because you'd be surprised even within a small community setting, the lack of knowledge of community resources associated to help increase your education or your knowledge, whether it be on HIV or STVBIs or any type of harm reduction. Oh.
Yep. 1 second. This one's for Claudia. How can we ensure that we're balancing reducing stigma with respecting folks' privacy?
Well, I think if we're talking about, are we talking about prison or are we talking about outside? I mean,
Prison.
Prison. Okay. So for us, how we want to respect the status of prisoners inside. So, our main thing is that we always have to think of just like on the outside, but even more so here, because again, as I said, if we sometimes we have to talk to healthcare, for example, to doctors. It does actually exist that people call us and say, I haven't received my meds, or I was supposed to receive my meds yesterday and I didn't receive them. And so we would have to advocate. So that would mean that we would have to talk to healthcare, or go all the way up, to different departments, including the superintendent, which would be the highest, or the warden. And so that's challenging, but it's really just about, having conversations with the person. And this is outside as well. Always making sure that you have consent and that person is actually out as being HIV positive. So for us, it's really about respecting, especially in prison, because nobody does respect the privacy for the most part. I'm sure there's some folks that do. It's definitely in healthcare. but for the most part, it's always checking in with them out of respect, right? And never disclosing to anyone unless you have full permission by prisoners.
The next question is now coming in. This one's for the Reverend. How can stigma, stereotypes, and social exclusion look different to young people?
It's been a long time. Power kind of keep the power to themselves and are unwilling to share it.
I believe we were on mute, so let's redo the question.
Okay.
Sorry for the technical difficulties. Sure. So the question was, how can stigma, stereotypes, and social exclusion look different to young people?
Yeah, so I think young people often experience feeling stigmatized or discriminated against or not taken seriously, at least by the powers that be in the world around them. So I think a conference like this is wonderful, where there are young people who are organizing it, doing it, not waiting for permission from somebody else to do what needs to be done. I think sometimes people may be dismissive of younger people. They say, well, what do you know? What's your experience? How, what's your education? Do you have this status as we define it? But don't allow the fears of others to control your actions. And that's the only way I know to fight stigma is to resist it and do the right thing.
That makes total sense. So our next question is for Claudia. Our next question is for Claudia. What do you think is the mindset/attitude young people should have when facing inequalities? And what stereotypes to overcome them?
I think, for the most part, it's important for anybody to actually be able to think within themselves and their own reality. So what would you prefer and how would you like to be treated if you have this secret that nobody knows and you're terrified about being able to talk to anybody about it? And so I think, once you look within yourselves and see how things actually impact you, I think it's very much important then to be able to take action, which I see that, this conference is doing. It's really great to see youth taking action. And by action, I mean, being really up to date with everything having to do with HIV. A lot of folks are not educated, even on the outside, are not educated about HIV, which I'm very surprised about. And so first things first is educate yourself. Second thing is involve yourself as much as possible anytime you see inequality and inequity. It's super important to be able to be out there on the front lines. Volunteering for HIV and AIDS organizations is super important. And that's one huge way you can contribute. And getting out there when there's marches. December 1st is coming up, a World AIDS Day. It's super important for you all to be there. And I hope I see a lot of youth out at some of the events that will be happening around December 1st.
So our next question is for Milo. What do you think healthcare workers in the First Nations need to be aware or are missing when delivering service to Indigenous clients?
I think that's a very important question, and it's something that we kind of hear conversations about actively when serving in community directly. I feel that being aware of social issues and stuff that's going on within your community is more important, and having a more empathetic approach or a non-judgmental approach would be extremely important, because I find that there's often educational gaps on both sides, whether it be social education or be like the books and learning part of education. But I think that it's extremely important just to be aware of what's going on in communities. That way you can have relatable conversations during I mean one-on-ones. If there's a healthcare worker that's dealing with a client that might have a lot of questions, not responding to the questions in a way where they feel like you're using words that they might not understand. So it's giving the information in a way that your clients or the population is going to understand, instead of like medical jargon or terms that that people might not understand full from.
So our next question is for Philip, Reverend Philip. Do you feel that the division around COVID vaccination mirrors the experience of people who live with and work with people with HIV/AIDS, and what can we learn from it?
Yeah, I guess there's a couple ways I could approach that. When I think about people who are sort of in the health professions, who are working with people who have infections, there's their own fear about contracting things, and sort of, again, the importance of having accurate information. Fear often comes when we don't know what's going on. So being able to kind of make sure that we're informed and that we inform others about what are the actual risks, how might this infection be passed on to someone else? How is it not going to be passed on to someone else? So here we are both sitting here without masks on, but I think we're at a safe enough distance. I know I've been triple vaccinated because I work in healthcare, and so I've been able, so I'm willing to take the risk of being here face to face, because it feels to me that the face to face is more important. But it feels like an acceptable risk. We're always going to be taking risks whenever we are encountering another. And I guess the question is, are we going to allow the fear to control how we interact with each other? Do we acknowledge the fear? Do we pretend that there's nothing to be afraid of? But how do we just sort of genuinely respect ourselves as we're respecting others? I guess that's just basic human life lesson, regardless of status in any way.
That makes a lot of sense. You bring up a lot of good points. And one more for Claudia. Claudia, do you have any advice on how folks experiencing stigma can respond without putting themselves in an unsafe situation?
That's a good question, and very multi-layered. So if folks are experiencing stigma, I guess the one thing, again, if we're talking about inside prison, the one thing is trying to find supports, as Laverne had referred to, is trying to figure out what supports that they can have, if most likely they're not going to be able to get it inside the jail or prison. And so that's why organizations like us are very important that we exist, so that people inside would be able to call us. We have situations where people disclose their status, and in that time of disclosing status, then we're able to educate, and then we're able to support, send supportive information, connect them, link them with as many organizations that are able to help them, and provide education, provide supports, including legal supports, may be something that folks are looking for. So once that is happening, then people feel valued, they feel listened, they feel respected, and feeling valued, listened to, and respected is something that does not happen often inside prison. So, those are the key things that really need to occur. And as volunteers, anybody that's going inside prison, always keeping in mind that stigma does exist. Stigma impacts everyone very heavily inside the prison system. educating staff, which is not very possible within prison, as they would prefer to hire consultants to be able to do that. But having relationships with people in the institution as well is great, especially if you develop a good one. Then it means that they can actually provide support to the prisoner when they're inside. So social workers, other educators, volunteer coordinators, very crucial to be able to have those supports for folks to deal with their stigma.
And for our last question, we have one for the whole panel. We'll start with Philip, then we'll move to Claudia, and then to Milo. So let's start with Philip. So here's the question: is there a way to be compassionate and not perpetuate stigma, and simultaneously address harm reduction for people we may know who could be at risk of contracting HIV?
There's a lot of parts to that question.
Yes.
I may not capture every part in my answer, but it's a good question. I guess when I think about compassion, I think about really it is recognizing that I and the other are really no different. I used to do some stigma education stuff when I was at Casey House. And for example, we were dealing with a client who may have been a Casey House client who's now moving into a long-term care facility. And the staff there were very concerned. There was a lot of fear and lack of knowledge. One of the things I used to do with them was to ask them the question, have you ever gotten behind the wheel of a car with less than 8 hours sleep the night before? Do you, every time you get in the car, do a walk around to make sure that there's nothing wrong with the vehicle, that all of your tires are properly inflated? Have you ever gotten into a car without first checking the blood alcohol level of the person driving? If someone gets into a car accident, and we know that those are risk factors associated with car accidents, I have not been seriously hurt in a car accident, but it doesn't mean that I haven't engaged in behaviors that could have led to me being in a car accident. I'm not HIV positive, but I was born. Some people contract HIV, mother to child transmission. I've been in hospital and received something that may have been related to a blood product. People have contracted HIV. I've had unprotected sex with people. I could have contracted HIV. The fact I don't have HIV is not that I've done something right and others have done something wrong. I can't sit in the position of judgment on that. So I think compassion is about saying, it could be me. And I do then want to help whoever I care about think about what is risk that they're taking, what's acceptable, what's safer sex, what's, where do you go if is there something, so something that's happened somewhat recently is thing called healthcare tourism, where people go to other countries to get operations done rather than get it done here or pay for something here. Do you know what the risk factors are if you're having an operation in some other part of the world? Think about what you're doing and the consequences of it. I guess that's what compassion is for me. I'm with you in this, and we need to think about what makes sense.
That makes sense. Next will be Claudia. It's the same question. I can repeat it. Is there a way to be compassionate and not perpetuate stigma and simultaneously address harm reduction for people who we may know who could be at risk of contracting HIV?
Like Milo says, that's a lot of stuff in one question. So I just want to quote Anais Nin, who was an author, who said, "We see things how we are and not how they are." So that's something that's really important when you want to be compassionate to others, especially for folks who use drugs. what I find is people get into a savior mode, people get into, opinions, and really that's not helpful and not compassionate whatsoever, because what we actually need to do is meet people where they are at in life, be able to respect them, right? One of the things when you're working with prisoners, but even working with ex-prisoners, is to be authentic when you're relating with folks. There are so many barriers for people, and one of them is people not understanding the position that folks are in who use drugs or have been homeless, Indigenous folks, and how they navigate life, and the importance of their traditions and their knowledge and their medicines is something that's so important and not respected sometimes when you go into service organizations for people living with HIV. So being able to also respect all aspects of that individual, not just the fact that they live with HIV, but also just all aspects. The main thing is never impose your own opinions. You deal with that individual as they come to you.
And then Milo, same question for you. It's the same question. Can you repeat it? Is there a way to be compassionate and not perpetuate stigma and simultaneously address harm reduction for people we may know who could be at risk of contracting HIV?
I believe it starts with understanding self and putting yourself in a position where you might not necessarily be able to relate, but you have a general understanding on how that person may feel. You don't want to create any stigma, any internal stigma through indirect conversation. So whether that be educating yourself, so you can protect yourself. I remember, I'll just get into, when I first started at HON, my HIV information and education was very low. My understanding, and I almost had it was almost like I was almost creating a stigma amongst myself, trying to become comfortable with the fact that me working with the HIV organization is I'm going to be interacting. So it's understanding myself and if I take the necessary precautions and to protect myself. We talk about harm reduction a lot, and it means like if I have a Band-Aid, if I have a cut, do I put a Band-Aid on it? If I do put that Band-Aid on it, I'm contributing to harm reduction with myself and my community and everybody around me. So I think understanding self and then identifying what you can do as far as harm reduction and contribute to the lack of stigma or the lack of contributing to stigma is very important. And it really starts with you. Not necessarily, again, putting yourself in anyone else's shoes, but having a strong understanding that, it goes back to when you were kids and how would you feel if that was you, or if you could put the shoe on the other foot, how would you feel? I mean, nobody likes to be feel discriminated against or to feel like somebody is judging them. So I think an unbiased eye is extremely important. I use that terminology in my workshops a lot. Because we're often looking at things from a biased eye based on insight or based on education. But if you look at it with an unbiased eye, meaning you're peeling back what's on the outside to see the person for who they are, because you never really know what somebody's story is. And the most important part of not understanding someone's story is being understanding to potential traumas or potential situations in that story that kind of led them along the path that they're leading. So I think I try to answer all the questions in one, but I hope that helps.
And yeah, with that concludes our first session of No Time to Wait. We hope you enjoyed, and we'll see you in the next one.
Thank you, guys.
Thank you.